and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania with Wellness Associates and Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. On today's episode, we want to talk about the problem of work-related injuries. We had one of our viewers write in. They got injured, it was probably about 4 months ago. They've been dealing with a company doctor, back and forth, no real results, taking a couple different medications, frustrated. Their quality of life is going downhill. And they just want to know, what would chiropractic care do different, or what would your approach be, and how is it impacted through this whole workers' comp situation out there?
To me, Jerry, chiropractic care is always the first line of defense, even before drugs, because we get to the underlying root cause of their pain, pins and needles, numbness, or burning. Evidently, they've been traumatized, okay? So if you had traumatized, therefore it's a sprain strain. We help your muscles. We help the nervous system. The nervous system, your brain and your spinal cord, if it's pinched, that's affecting that cell, that organ, that muscle. It's affecting the functioning performance. We relieve the spinal cord pressure with what is called a chiropractic adjustment. What a concept. The company doctor's not going to tell you about it. And the best of both worlds, Jerry, is we would do physical therapy to increase circulation, promote healing, speed up the healing. And if we do that, you give them exercises. We also do nutrition. We do non-invasive acupuncture. In my experience, 99 times out of 100, you don't need surgery. Because I know in a couple more months, the company doctor is going to say, Susie, we're not getting the results. You're going to have surgery. And there's no guarantee that that's going to fix her either. Okay? Because my understanding, Jerry, if you look at the statistics, 50% of all spinal surgery, the patient is worse. So she has a 50% chance of waiting 2 months, not getting the results, getting the surgery, and she's going to be worse. And what's that going to do to her going back to work?
Right.
My understanding, the statistics show, they did something like 13 different studies proving that chiropractic gets you back to work better, sooner, quicker, and cheaper. What a concept.
Yeah. And I think it's important for our viewers to understand that they do have options available. If they've been dealing with the company doctor for a while, a couple months, and just get, because I think a lot of people are at that point, that frustration point.
Right.
They're not able to get back to work. Quality of life is just deteriorating. They're looking for options. But sometimes I think it's important to understand that they're even told things that might not be correct.
Right.
They might not realize that they can come and come here, get evaluated, get treated here at Wellness Associates. They might be thinking they have to only stay with that company doctor. And if it's been 3-4 months, they have options.
That's right. So especially if they're with the company doctor and the company doctor's not helping them, they're not getting the results, then of course you have the right, it's a free country, to get a second opinion, which we give what is called a conservative second opinion, or we're going to help you get to the underlying root cause of the problem, and we're going to do it without drugs, without side effects, and without surgery. That to me is a first line of defense, Jerry. That's the way to go. That's what I would do.
Right. And not get forced into just taking a strong painkiller and getting back to work.
Is this a free country? Are we being forced to do health care? How can you force health care onto somebody?
Right.
Okay. I want free will to do my health care.
Right.
If I had a choice between chiropractic and drugs, I'm going to choose chiropractic. That's my choice.
Right. So I think it's important to, for all of our viewers just to understand that it is up to us anymore. Okay. Your health is your responsibility. You don't have to listen to other people. You can always get second opinions. Look at, exhaust all options, and really come up with what is the best program for you. One of the things that we always encourage here is that Dr. Goldberg offers a free new patient evaluation where you can come down, meet him, kind of discuss your problem, look at what's going on, and kind of, pick his brain. He's got years of experience treating people with these various conditions, and I think you'll be, amazed at how, a simple conservative approach could be that missing ingredient to their problem.
For sure.
So, just take an active role in it. Come down to the office, pick up the phone, give them a call. Girls at the front desk are awesome. They'll get you in. Come down, meet Dr. Goldberg, and kind of, bring your questions here. I think you'll be amazed at the approach and the answers that he'll have for you, and the impact that it can have on your overall health. Because one thing that we want to make sure, these problems continue to kind of get worse and worse and worse. Early treatment, very important. Don't wait, don't put it off. Come down, get that evaluation, and see firsthand what can happen. So we hope you found this educational in regards to work-related injuries, dealing with company doctors, getting second opinions, and what's available to you. So we just encourage you, pick up the phone, give Dr. Goldberg here at Wellness Associates a call, come on down, meet the staff. We think you'll be pleasantly surprised at the results and the, the atmosphere that you have here. So with that, thank you very much for watching our episode today. Be sure to check back periodically. We've got some great shows coming up this month. And if you have any specific questions that you would like us to address, feel free to click on our Ask the Doctor area, type in your question. We'd be happy to feature that in one of our future episodes. So thank you very much for watching, and we look forward to seeing you on the upcoming shows.